Let's take you to President Cyril Ramaphosa at the UN.
To the work that we are doing, I'd like to extend my greetings to President Duma Boko, President of the Republic of Botswana, and the Chair of the African Leaders Malaria Alliance for joining us, and Your Excellencies, Ministers, Deputy Ministers, and leaders of various organizations, funders, as well as many other non-governmental organizations who are here. It is a real joy and pleasure to have all of you here. It does give me a great deal of pride to co-host this very important event with President Boko. Today we stand together, in some ways united behind a bolder global health security agenda. We intend to move forward collaboratively to protect and preserve the health as well as the well-being of the most vulnerable populations all over the world. Over the past 3 years, the Global Leaders Network has established itself as a united force of sitting heads of state and government to improve global health. And I'm particularly delighted that a number of my colleagues, my brothers and sisters, heads of states and heads of government have agreed to be part of this very noble effort. Much as they are not here, they are participating with us in leading this whole effort. Our focus is on the health and the well-being of women, children, and adolescents across the world. The Global Leaders Network has been building consensus on various solutions to the most pressing problems facing global health today. Since we met last year on the margins of the United Nations General Assembly, the challenges are escalating. Conflict, displacement, economic shocks, and the climate emergency have in many ways reversed hard-won gains in health and development. Women, children, and adolescents, those whose well-being defines the future of every society, are bearing a disproportionate burden of the problems that the world faces. The international community pledged through the Sustainable Development Goals to end preventable maternal, newborn, and child deaths, and to secure universal access to sexual and reproductive health services by 2030. While significant progress has been made, survival gains have stalled since 2015. Unless we take bold actions, it is estimated that 60 countries will fall short of meeting the Sustainable Development Goals target for the under 5 mortality, and 65 countries will not make or achieve the SDG target for neonatal mortality. Over 700 women die every day from preventable diseases that are related to pregnancy and childbirth. And they die every day. Many of these women are adolescent girls. Complications from pregnancy, including unsafe abortions, are the leading cause of death amongst girls that are aged 15 and 19 years. Behind every number is a family that is torn apart, a community that is destabilized, a future that is cut short. The cost of inaction is simply staggering in the way where these lives are lost and the lost potential. According to McKinsey and the World Economic Forum, closing the women's health gap could generate up to $1 trillion annual boost to the global economy by 2040, while delivering tens of millions of healthier life years. This underscores the huge return we forgo when we fail to invest. A great concern of the Global Leaders Network, which we share with the African Leaders Malaria Alliance, is the sharp withdrawal of official development assistance for global health. Since last year, many critical programs for women's and children's and adolescents' health have collapsed or face severe cuts. Immunization campaigns are being scaled back. Maternal health services are closing. Adolescent sexual and reproductive health programs are also disappearing. Essential programs to eliminate malaria have been compromised. This leaves millions without care and erodes decades of progress that has been made so far. All this unfolds against a backdrop of intensifying conflicts. Wars destroy clinics and hospitals, and in a number of cases we have seen how clinics and hospitals have been targeted for destruction and for bombing. All this also disrupts supply chains for essential medicines that are not able to reach the people who need them most. And all this, the wars that expose women and girls to heightened risks of violence, such as rape and great abuse and trafficking, as well as exploitation. In 2023, countries with humanitarian response plans, which include fragile and crisis settings, accounted for about 64% of global maternal deaths, 50% of newborn deaths, and 51% of stillborns. The Global Leaders Network is dedicated to building global ties and strengthening cooperation between and within countries. To this end, we are delighted that we are able to demonstrate a united front between the Global Leaders Network and the African Leaders Malaria Alliance. In July this year, President Duma Boko of Botswana wrote to me to suggest that we work together on a gap financing mechanism for global health to address the cuts in official development assistance. President Boko will talk more on this today and the steps that will be necessary to close the health financing gap left by the withdrawal of much official development assistance. As the Global Leaders Network, as all of us gathered here today, let us reaffirm our commitment to three priority areas: increasing investment, universal health coverage, and upholding sexual and reproductive health rights. I wish to convey my sincere thanks to everyone who is present here today. And today is unprecedented in the sense that we've got so many people gathered here who are interested in the work that we continue to do. This signals in many ways a strong and sustained commitment to women and future generations, the generations that will be responsible for growth, for progress, and for shared prosperity. We look forward to productive deliberations, but we also look forward to bold commitments and determined actions that we all should take. Bold actions that will address the challenges that women, girls, and adolescents are facing with regard to their health. So we all have an important responsibility, not only as governments, but also as various key stakeholders in every country of the world. So I thank you, and I want to especially thank our moderator here, Right Honorable Helen Clark, for her continued commitment in this work. In fact, without her providing the inspiration that she continues to give to this work, many of us would not be able to have the energy and the stamina that she is inspiring us with. So thank you very much, Helen, for all the work that you continue to do. Thank you all.